there's such clear evidence about how potentially dangerous this virus is, and we don't yet have all that we could have, including a vaccine that could change how we face this. On the other hand, we have a lot that we can do today. We know that masks make a big difference, that social distancing, testing used judiciously can also make a difference. So I think there's so much that we know that can be done today that can continue to reduce the transmission of this. And so I think while a vaccine is incredibly important, we want to make sure that people are still paying attention to the things that they can do today to make a difference for something that is still a very serious situation and has taken, as you know, hundreds of thousands of lives here just in our country and many more around the world.
Dr. Gale, as you say, we know what needs to be done. The CDC guidelines are incredibly clear, yet you have the president, taking off his mask in a show of strength and, likening this, as I mentioned, to the common flu. So we know what needs to be done. But when you look at the U.S.'s, the way that it's dealt with it compared to perhaps some other countries, how do you get people at a large scale to follow these guidelines? And again, do we risk people becoming cavalier because of the last 24 hours and what we've heard from the president?
Everybody faces health challenges differently. I think it's incredibly important, though, that people listen to the scientists. Every day there are people who are talking about the evidence, talking about what we know makes a difference. And so I think we have to really continue to listen to our public health officials and the science as this continues to evolve. And I think each of us has a responsibility for our own health, but we also have a responsibility to each other's health. And we've seen that taking into consideration the basic things that we know make a difference, wearing masks, social distancing, hand washing, staying at home if you're not feeling well, all of these things that can make a huge difference. And we've seen around the world the countries that have put those public health measures into use at a national level, that it has really made a difference. So I think there's a lot more that we could be doing, and we need to keep listening to our public health officials and continuing. These are simple steps that everybody could take that could make a huge difference while we continue to wait for a vaccine, which again, we know a vaccine is going to have a huge impact, but only if we do it in concert with these other public health measures.
Yeah, I like the lasagna metaphor people are talking about lately. Hopes for a vaccine, but you layer it with everything else, isolation, distancing, and masks, and so forth. Dr. Gale, Reuters this morning has looked at some documents that says the FDA staff will hold a panel meeting on October 22nd to discuss studies to test safety and efficacy of the candidates. They also say that they've told the vaccine makers that any request for an EUA should have data that includes follow-up duration of at least 2 months. And I wonder if everything you've heard so far about timeline, does it make sense that we could still be getting some kind of EUAs issued by, mid-fall, end of the year?
Well, I for one, believe that we shouldn't be in the prediction game. We have really accelerated the speed to developing a vaccine, beyond what we've ever seen before. And we've done that because we've been able to do things in parallel as opposed to sequentially. But anything that goes wrong along the way in any of these trials could mean further delays. Now, if everything goes right, towards the end of the year, early next year, we might have 1 or 2 safe vaccines that could start to be deployed. But I think this is an incredibly complex endeavor. And, we want to make sure that the FDA is able to do what they think is in the best interest of science. Because if we have a vaccine, but people are concerned about the process to get to developing a vaccine and aren't going to take it, there's a difference between having a vaccine and people actually being vaccinated. And what we want is to have people have confidence in the process so that when a vaccine is available, people believe that it is safe, it is efficacious, and that all the steps have been taken to make sure that those things, that both of those, the safety and the effectiveness, their efficacy, have been well studied. I think it's critical. We know there's vaccine hesitancy. I think it's critical that we assure the public that the right steps were taken, that we did not take shortcuts, so that we can trust this vaccine and we can get people who need it vaccinated as soon as possible. And as you know, we put out a study last week, the National Academies of Science. I co-chaired that study looking at an allocation framework for the vaccine so that we were ready to look at who should get it first, who should get it later. And I think it's important that we remember that we want this vaccine to get to the people who need it the most as quickly as possible.
Shepard Smith here. Thanks for watching CNBC on YouTube.